Hello, good morning, friends. Here, Dr. Milton here. Today, I'm going to discuss about one of the biggest health burden in the world. It become epidemic, endemic. At the moment, it's become the pandemic, and the World Health Organization has declared the obesity and overweight as a non-communicable disease. Everyone should understand obesity and overweight. It's a chronic disease, and there is a cure as well. To understand well about obesity and overweight, there are many aspects has to be concerned. First, you have to identify the etiology of the obesity and overweight. That means why you are obese. There are many factors which influence the obesity and overweight. And the second thing is you have to understand the complication of the obesity and overweight. If you understand those two aspects very much well, we can proceed with your physical stated parameters. That is the third thing. And finally, the intervention strategies. So we will start with the etiology of obesity. Of course, it started with the number one etiology, or the number one cause would be uh, you have a family history, or you have a genetic predisposition of obesity that has a very big role. Even if you see in the families, many of them, uh, the parents and their grandparents, they are must be obese. Of course, the children, of course, they have a genetic predisposition. That causes the first thing. The second thing, what we can say, is physical inactivity. The physical inactivity, what do you mean by physical inactivity? Couple of people, they have a habit of sleeping for a long time. 6 to 8 hours sleeping for a human, it's recommended. For the children obese, it's sometimes vary. But the people tend to have a habit of sleep for a long time, and they will sit on the couch during working time, and sitting in front of the laptop and computers for a long time. You probably have experience in the office premises. They will spend more time on the sitting on the chair. That kills you. That makes you a sedentary life. And some of them have a habit of watching TV, uh, while eating, while having a junk foods. They have a habit of eating junk food. And you probably have seen some of them addicted to the social media, like Facebook. These all sort of social media, they have keep on addicted. They spend even throughout the day with the social media. So those are very curious issues, and they are more towards using the transport. Even they, I have seen a couple of people, they're reluctant to even walk. I don't know why. Even for the small distances, they like to travel by the vehicle. So that aspect, physical inactivity, that is the second major cause of obesity. And the third major cause is something called overeating. Couple of people have a habit of eating these fast food, junk foods, which have a high carbohydrate, high starch content, and they have a tendency to eat very frequent per day. Those have a very vital role in the obesity management. And couple of people have using the medications such as steroids and corticosteroids and oral contraceptive pills to prevent pregnancy and family planning aspect. Some people using these antidepressant drugs, anti-epileptic drugs, in something anti-diabetic, anti-hypoglycemic drugs such as insulin and sulfonylurea. Those drugs can lead to obesity for you. And there are other social factors which causes obesity and overweight. The number one, the stress in your working environment, stress in your family, stress uh, with the exam tension, stress with the university studies, stress with the workload. Those aspects having a big role in the psychological aspect. And if you feel sad and loneliness, of course, uh, you feel alone and you tend to have a habit of eating a lot. Sometimes that may be possible, you may withdraw your foods, but couple of people I have seen, if they are sad and alone, they have a habit of eating a lot. And anger, which tends to stimulate you to more and more obesity. And there are always a social stigma. The obese people, when they are mingling with the society or when they're wearing a dresses, there is always a concern. They are always worried about their physical appearance, and and how the people they are thinking about that. That may worsen the chances of getting the obesity worse. The other major issue of obesity is smoking. And I have seen even the female are smoking even in our country. And there is also a concern about passive smoking as well. Of course, childhood obesity, which plays a main role. If you are in childhood obesity, there are higher chances to get your obesity in your adulthood. It's very high. And there are of course social issues like you don't have money to buy a good nutritious foods, and you don't have access, or you have you don't have a knowledge education level to choose what are the good foods and all. And there are, when you are obesity, there is always, you have to think about few things. For instance, the obesity always associated with other diseases such as hypothyroidism, Cushing, polycystic ovarian diseases. And if you have a lack of growth hormone and lack of sex hormones, and if you have insulin resistance, those are the aspects which cause you to be obese. For instance, if you are hypothyroid, yeah, you feel fatigue, there are many signs and symptoms. We will discuss each and every one with the in the frequent lectures. And another very important aspect I have seen, especially among our community, soon after the postpartum, they fail to do some physiotherapy activities. There are postpartum exercises they fail to do. The postpartum exercises for the abdominal muscles and for the pelvic muscles. And soon after the postpartum, all the females tend to be obese, and there are high association with the gestational diabetes. If you have diabetes during your pregnancy, those even causes your obese. So in my summary, to understand about obesity and overweight, you have to understand the causes why you are obese and overweight. Then only you can uh, really understand where you are. From that only you can interact and implement your strategies. So starting from physical in physical less activity, and your genetic predisposition, and you're using the medications, and there are social issues, and there are many diseases that can cause us, and there are pregnancies and postpartum exercises can cause us. So you have to understand where you are staying. That will help you to understand the implementation strategies of obesity.